I began my nursing journey back in 2009 at Royal Perth Hospital, where I was doing a 2-year grad program, and it was in my final rotation that I worked on the haematology ward that specialised in bone marrow transplant, and from that moment on I was hooked, and since then I've been working in haematology. So I worked at Royal Perth for about 5 years. From the ward I transitioned to the outpatient space, which I really loved. I loved looking after patients who were feeling relatively well, who came in for their treatment and went home, and I loved being part of that journey and educating them on how to keep themselves safe while they're having treatment. Following my time at Royal Perth, I transitioned with the transplant service over to Fiona Stanley Hospital, where I worked for another 5 years, again mainly working in outpatients, learning how to do stem cell collection procedures, again lots of chemotherapy, lots of patient education, and I guess really developing my expertise in malignant haematology. And then in 2020, I was really fortunate to move to Sir Charles Gairdner Hospital to establish the role of the lymphoma clinical nurse consultant. It was an amazing journey, developing the role, kind of learning what patients in that space need, and growing the service with a really amazing team. And then most recently, a couple of weeks ago, I began working as the lymphoma nurse practitioner at Sir Charles Gairdner Hospital, which has been a lifelong goal for me. So it's been amazing to start that, really grow the service for patients with lymphoma at Sir Charles Gairdner Hospital. BCRWA is really intrinsic to my role and the work that I do, and I don't know that the role would exist without them. As big institutions, I think hospitals see the value in senior nurses. They know that it improves patient outcomes, but sometimes they need a bit of encouragement to know that the roles will be financially viable for the hospital. And with the seed funding that the generous donations of BCRWA has provided, it's not only allowed the lymphoma CNC role to be developed and then to become self-sustaining, but it's also allowed the lymphoma nurse practitioner role to be created. And without that funding, I don't know that it would have happened or happened in such a timely manner without it. So that was true of the lymphoma CNC position. That's now been running for 5 years and has helped hundreds of patients receiving lymphoma treatment. And now that's the same process for the lymphoma nurse practitioner position as well. It takes a lot of work and dedication to become a nurse practitioner. You need to kind of have a niche area that you specialise in, and have done some postgraduate study even before starting the master's program, and then you need to undertake a 2 years master's program, which is pretty grueling, especially when you're working full time, but it's extremely rewarding. It was only possible for me to complete that with the amazing supportive team that I've worked with at Charlie's, who were really understanding of the course requirements and certain boxes that I needed to tick. And once you complete the 2-year course, there's a lot of other hoops that you need to jump through, and kind of getting the hospital on board to create the position took a bit of effort as well. But now the role has been established. It's really exciting to be able to grow the lymphoma service along with the lymphoma clinical nurse consultant. It's an extremely unique service within Australia. As far as I know, there's only one other lymphoma nurse practitioner in the country, so it's a huge privilege to undertake this role and better serve the needs of patients with lymphoma in Western Australia. I'm really excited about it.